are struggling with a significant budget deficit, and the question of sustainability has to be front and center here. And so I think the governor noted that we're going to have to pay for this one way or another, and she's absolutely right. I wouldn't disagree with that at all. However, her budget leaves me scratching my head a little bit, because it's not a question of whether we pay, but it's how we pay and who pays that is the relevant issue here for us in Rhode Island in the spring of 2015. And I think that the big challenge that we're looking at is that we need to find a way that makes sense going forward so that we're not constantly shifting direction. My point in the op-eds that I wrote in the journal was to try to put this conversation front and center. I think we need to have a candid conversation about what makes sense here. Fiscal restraint has to be, in my mind, the order of the day. This has to be a fiscally lean system. And we're spending $52 million, and about $25 million of that is dedicated to unified health infrastructure. I understand that. Still, $25 million in administrative cost for a program that insures 31,500 people is a very high administrative overhead. And so, for me, looking forward, as the General Assembly starts to think about how to finance this, I personally tend to favor a user fee model of financing for this system. And what I mean by that is that the folks who use the exchange should essentially help finance the exchange. And I know folks will object that that's a burden. But I will suggest that the folks who are already purchasing insurance through the exchange are receiving dramatic discounts on insurance right now. They are receiving subsidies from the federal government. 86% or so of folks are getting subsidies to purchase their insurance through the exchange. I just don't think, from where I sit, that the notion of asking small businesses to contribute to the cost of financing an exchange that they do not use makes political sense or economic sense. And I don't think it's consistent with the governor's notion of trying to grow the economy and create a more business-friendly environment. However we want to label it, we can call it a tax, a surcharge, an assessment. It is what it is. It's raising the cost for small businesses if we choose to finance it this way. The alternative is if we use a user fee model, I think we can give the folks at HealthSource a strong incentive, a fiscal incentive, to grow the operation, to make a business case for using HealthSource Rhode Island to get more customers, which will spread the cost among a larger group of people. In the long run, I think that's a far more sustainable model and a model that will be better for us in terms of economic development.
So you've raised a great topic, and I know that Gary has some thoughts on that subject that I want to get to in just 1 second. But before we go forward to that, let me go back just a little bit. I think, did we include Don in our packets this morning, or Al, some of Dr. Hackey's research? Can you just kind of take us through those?
Sure.
If everybody wants to look in the packets that are in, Sandy, I don't know if we have the ability.
There are a couple of tables in here in your packet. It's right after it says HealthSource Rhode Island panel materials. There's a first table and there's a second table. I'd like to actually start with the second table. Because this is a table that's using data that was it's comparative data from every state, including DC, and the handout is labeled "Individuals who selected a marketplace plan, 2014 to 2015 open enrollment periods." And what basically this shows is the percentage change, the actual numerical change and the percentage change, and the number of people who bought a plan through an exchange in each state. And so you can see, this is, by the way, for 2015, the data is available through February 22nd. That was the most recent data I could get. What's notable here, and I think this is an important thing, year 2 is better. Year 1, we all remember the rocky rollout. Year 2 is much better. Almost all states are doing substantially better than in 2015 than they did in 2014. Year-over-year increases of 46% or more in terms of enrollment are common. And as a matter of fact, that's the national average. Across the country, 46% increase in terms of number of people who signed up for policies through the exchange. Massachusetts, for example, our neighbor to the north, struggled deeply last year. They had a really tough rollout. They are now leading the pack in terms of percentage increase. They didn't, to be fair, they're coming from behind, if you will, because they did not have a particularly successful first year. If you look around our state-based marketplaces around the country, Maryland also had a tough first year. They're doing very well. DC is doing very well. Lots of federally facilitated and partnership models are doing very well. Connecticut trailed the national average, but they're still up 39%. And so you ask, where are we? I'm looking on page 1. We're not there. Flip with me to page 2. We're 48.
Now, Professor Hackey, let me, even before Director Wallack, that's maybe, is it possible that part of that is that we did better in the first year and that the platform was more solid?
I think certainly that's the case, and I would direct your attention to the previous graph, the previous chart rather, where if you look at our administrative efficiency chart, in the first year, this uses data from the Kaiser Family Foundation. They're a nonprofit, nonpartisan health policy think tank. In the first year, in the last 2 columns there, the Kaiser Family Foundation has a wonderful measure of what's the proportion of people we enroll who are eligible for subsidies. And Rhode Island in the first year did quite well. And so your point is well taken. So we enrolled about 38.9% of eligible enrollees, which places us 5th in the country. So you would say that's good news. This year's data, which I don't have in the form of a chart, it is available on the Kaiser Family Foundation website, we've fallen to 17th. We're doing okay. We're doing well. But we're not a national leader on that front. And so I think for me, coming back to the question, it's not, are we signing up folks for insurance? We are. The question for me is a value proposition. What are we getting for the millions of dollars that we're spending on HealthSource? And right now we're spending somebody else's money, which is always a much easier proposition. Going forward, we're spending our money. And so I think we have a really fundamental challenge to figure out how to get the most bang for our buck from this. And I think my goal here today is not to say that my measures are the only measures that we should use, or that these are better than somebody else's measures. My goal is to start a conversation about which measures. Because I think we can't make decisions about HealthSource Rhode Island in isolation. We need to benchmark ourselves against every other state, and if we're not doing well on particular indicators, we ought to have an explanation for why we're not doing well on those indicators, and we ought to have a plan for how to do better on those indicators, unless somebody can persuade us that those are the wrong indicators.
So, Dr. Hackey, let's let Director Wallack respond, and everybody in the room, let's remember that Director Wallack's had 67 days to address what she inherited, so.
Actually, I didn't start until the next day after.
Which, from a percentage standpoint, is significant.
No, I think you hit the nail on the head in terms of the data. We did really well in year 1. So your expectation would be that relative to another state where they made a small dent in year 1, we would do less in year 2, but I think we still have a lot we can do to enroll individuals who are eligible on the individual side, and there's lots we can do to increase our penetration in the small employer community. I do want to get to the efficiency issue though, because frankly, I hate talking about federal money like it's somebody else's money. I don't find that to be a particularly compelling argument. Senator Whitehouse would probably agree. That's our money too. And I think that what's really been lacking in terms of these first few years of exchange development across the country has been fiscal discipline. And it's come home to roost now. We have to deal with that. Whether it's their money or our money, with air quotes, it's time to figure out how we can do this efficiently. I absolutely agree. It's time to look at how we measure our success going forward. That's my job.
I did a thing several years ago with Director Ferguson around measures of success for the exchange, and it wasn't directly interactive. She followed me up on another topic, but one of the key measures that I felt was important, and to Dr. Hackey's point, is closing the gap on the uninsured. And it seems like you share that as a key goal.
Yeah, unfortunately, we don't have great data. So
It's
the
funny,
data,
we don't.
Yeah, the data just cited comes from national samples, and we haven't done a good state-based sample in a couple of years. We're about to go out in the field, so we can better measure that with a good Rhode Island sample. And my intention is to do that every year so that we can track that, because I do think that's a key measure of our success.
It surprised me that we weren't, as an element of intake, requiring the information that would allow us to kind of get somewhat back to that. And have we changed that at all?
We do have information, so we ask people when they come into our system whether they had insurance immediately previously, and whether they, if so, or if not, how long had they been uninsured. So we have some data, but it's only from a sample of our customers, and I think we need much more robust data to measure our performance going forward.
One last question for you, and then I do want to move to Gary and to Representative McNamara. But when you look at the investment that we've made in the technology, which has been massive, right? I mean, most of the money that we've spent to this point, do you think we've, and I'm not really going to, I don't want this question to be, did we get a good bang for our buck, but did we get a good bang? Did we get something good?
I think there are parts of it that are good. You know, the guts of the system are working. But I think the verdict on whether we got a good bang for our buck is still out. And that this is the year where we have to prove that our vendor can produce a system that works for the money that we've paid them. This has been a challenge in every state, and it's been a challenge at the federal level. I think nobody understood the complexity of the systems that we've been building, and it's been done on what any reasonable person in the IT industry would have said is a totally unreasonable timeline. So we're all dealing with that. But nonetheless, at the end of the road, we have to have a system that works, and this is the year that our vendor has to prove it.
Excellent, thank you. Gary, I kind of want to pivot back a little bit to Dr. Hackey's comments about the user fee and his belief that the expense for the exchange ultimately ought to be borne by the participants on the exchange, that most of them, a vast majority, are receiving subsidies of one kind or another to facilitate their purchase of insurance, and that perhaps therefore, you know, it makes sense and they can afford it. Thoughts, comments?
Yeah, I think you have to go back and look at how we got here. And I really applaud what the governor and Anya are doing, coming in and taking a look at how we can operate an exchange efficiently. I'll make one political comment before I go further. There's going to be an election in this country in 2 years. And I'm not a betting man, but there are a lot of people working in that election, and what we talk about in terms of Obamacare, replacement for Obamacare, how exchanges work, how exchanges don't work, likely to be changed. So I would urge, caution in making policies during a very volatile time in this country over the next 2 years, because it would be foolish to make significant systemic changes right now, and 2 years from now be faced with some of the same kinds of questions. And before I answer your question, the facts are, and this is the inescapable fact.
Gary, can you maybe share the mic a little? We're sharing the mic here. If people hear, okay?
The inescapable, fact, which really creates a challenge for Rhode Island. There are two inescapable facts. One is the question of scale. In 2009, Robert Woods Johnson did a study, and they predicted that an exchange in Rhode Island would not increase accessibility or be affordable. That changed with the passage of Obamacare. The subsidies, federal money to set up the system changed that situation. But more recently, there have been two people that spoke about scale that I respected. Chris Kohler, the former commissioner of health in the state of Rhode Island, pointed out, and I think quite so, that small states that don't have scale are faced with some really very serious challenge of affordability and sustainability. So while you can operate the system more efficiently, you can't change the scale of what we have. And then one of the persons that wrote the Robert Wood Johnson report, she said, let me just take a second to quote it, "I do not think a state-based exchange can be sustainable in a state beside Rhode Island, and with so few carriers, I am not sure what value it adds. That's a direct quote. So the scale is, regardless of your philosophy or your political view, we do have a certain scale, a certain market, and it limits us. That is very real. The other issue is you can't undo history, and there may be some in the room that disagree with, but I think the way that we went about setting up this exchange was awful. In this system of government, I believe, I don't always agree with them, but I certainly believe strongly in the legislative process.
We're going to get there.
Okay, and so setting up an exchange, but not setting up a budget is a recipe for the mess that Anna has to clean up right now, and that was totally predictable. So we get down to the question you've asked on funding, and putting the administrative question aside, because until we answer the basic question of what the mission and goal of this exchange should be, it's very hard to talk about funding. If the mission and goal is to have transparent, standardized product and get uninsured people insured and make sure their subsidies are in right, that's one type of exchange. And that's not an exchange that is recreating our healthcare system. It's very different. And the goals need to be different, and the focus needs to be different. And we really haven't had that conversation. So until that's done, it's hard to talk about financing. But in terms of financing, I think that the proposal, and I agree with Professor Hackey that it should be based on user fees, but I also understand the scale issue. If you just have a user fee that applies to people inside the exchange, you probably won't generate enough dollars that are needed, even the $11 million figure. But if I was a competitor with the state of Rhode Island in the field of economic development, and I was trying to steal jobs from Rhode Island or create jobs, I'd recommend that you adopt the funding system that the governor's proposed. And let me tell you the reasons why, because the difference is not about funding the exchange in the next year or two, but it's how you do it and do the least economic harm, because there are really not very good choices because of where we are and where we come from. First place, the federal government charges a 3.5% fee on each premium. As I read the legislation, and Anya, please correct me if I'm reading it wrong, the proposed Rhode Island tax does not impose a statutory fee. You figure out what the budget is, and then you go back and do the division, and you figure out what the fee is, and the fee can change over time. And I'm not sure.
Yeah, I would just point out the same is true in the federal statute. The feds can change the fee over time too.
But that can be changed here without the legislature's approval.
That's true at the federal level too. And actually, in their most recent regs, they say we are not covering our costs with the fee at the current level.
And I think within the state system, as opposed to rules and regulations, there's legislative responsibility to deal with a whole set of issues, because the fundamental issue about setting up the tax is any tax needs to be viewed as a total tax strategy for the state. Because the governor is very focused like a laser on what she feels needs to be done to improve the economy of the state. One of the things that we know is that our tax rankings are low. I don't always agree with those rankings, but the legislature in the last 5 years has fixed up the income tax, has fixed up the corporate tax, has made progress on the estate tax. And so just to design a tax to support a program that's not cognizant of how it fits into the overall strategy is why we got to the situation we got to originally of having a tax system that was viewed as uncompetitive. So I think the way this tax is structured, I think the way the tax is set up is a problem. Don't think the tax is competitive. Again, correct, this is not my field, so correct me wrong. The rates, even if you did it this way, the rates are not competitive. It's my understanding that the rate in Connecticut is 1.35%. The rate in Massachusetts is somewhere between 2.5% and 3%. So it's non-competitive rates. It's rate increases that are indexed to something of spending, actually, which is the worst thing to index a tax to. It runs in some ways the legislative process. So I think that is a recipe for being inconsistent with all the other economic development initiatives the government submitted. It makes no sense to me. How do you fund it? And there are a lot of different ways to fund it. We know a user fee just on the inside won't generate the revenue. And what Anya has mentioned of getting the budget down to $11 million without knowledge doesn't sound unreasonable. And so let me talk about funding it. And there's a question, if you believe as I do, that health is an important social good, and it's not fair that taxpayers support health. If we need $6.2 million next year, it is just as easy to fund it from an appropriation for that year. In the governor's budget, and I don't want to pick this project over that project, but I'll mention this, and this is one example, and this is not a recommendation. There's $25 million as a grant to do things in the I-195 district. We don't know if we need 25, 30, 15. And so that was budgeted at 20, and $5 million was used to offset this tax. We could fund the exchange for the year, and we could have something called balance in the budget without running tremendous reputational risk. When we talk about tax policy and funding programs, we're insular. And we look at the relationship between the program that we're interested in here and where we get money. The rest of the world doesn't look at us that way. The rest of the world looks at our broad tax structure. And any time you make a tax policy that institutes a new tax, there are reputational risks and reputational gains. And the way this tax is set up, at least from my opinion, there are too many reputational risks that are going to have an adverse effect on a number of things. And so I see it as a very anti-job approach. And that's not too different from the governor and Anya about the need to raise the $6.2 million. But you need to do it in the context of broader public policy, not narrow public policy. And the reason that we're here is we set up an exchange that was driven, I think, by broad policy concerns, but really not a narrow vetting of the issue. And I hope we can avoid that mistake.
So I want to summarize a little bit because I think there's some really good points here, and I have the benefit of my own microphone, so for anybody who's struggling to hear it at that. I think, Gary, what I hear you saying is a couple of things. Number one, we have an election coming up next year, and who knows? Number two, we have an exchange that we've built and developed locally, and that until we know where the election goes, and to Dr. Hackey's point too, until we know where the Supreme Court comes down this summer, really making a substantial change to go to the federal model really doesn't make any sense whatsoever. So we're going to keep it here.
And I did a second thing that you have certainty of the election, but also we have a new commissioner of the exchange. We have a new administration that's focused on operating the thing responsibly and efficiently. And before we start, let's give them the opportunity to do that. Let's give them the resources they need to do that and then fund the exchange. But let's not create a tax system when our people who are doing economic development go out and have to explain something. Because we explain enough things as we try to get jobs in the state.
So fund it as a general expenditure for at least the next year.
For the year,
Right.
maybe 2 years.
So,
Can I just clarify something on
Of
the
course.
tax? So, as the governor said, we have to pay for this one way or the other. What we tried to do is mirror the federal methodology to the greatest extent possible in terms of the tax that would be imposed both on businesses and individuals. What the feds proposed is a premium tax. We've proposed loading it more on the individual side so that we could reduce the burden on small businesses in Rhode Island and actually bring it in lower than those Connecticut and Massachusetts levels at about 1% on small businesses and higher on the individual side, with the reason being that on the individual side, more than 70% of individuals receive advanced premium tax credit, 88% in HSRI alone. And the advanced premium tax credit actually picks up their tax under federal law. So what we're trying to do is really minimize the hit to Rhode Islanders in terms of the total tax. And if we use a user fee just in the exchange, the advanced premium tax credit doesn't pick up that burden.
and so, and I think these are great points, and in my role as moderator, what I really want to try to hopefully accomplish is create some clarity around different ideas and a good lively discussion, right? So, Professor Hackey, user fee, the people that are on the exchange, they pay for it. And the governor's proposal is a tax that does that to some degree, but also goes a little outside to hit other individual policyholders and small group policyholders.
As does the federal approach.
As does the federal approach, correct. And Gary Sasse's suggestion is, hey, for at least a year or two, let's step back from implementing any long-term funding strategy and fund it on general expenditures until we see what happens. And if I've understood the three views correctly, and I'm getting some nods, so I'm feeling pretty good about that, Representative McNamara, to go back to
Now
my,
you choose.
well, let's recognize that when we go with the use of the term buck, the buck stops with the General Assembly, and how this is going to get done really ultimately is maybe more appropriate for you to comment on.
Well, first of all, thank you for inviting me here today, and I would have to say that it's very refreshing to have a governor and a director that are looking at the fixed cost. You are all business people, and you know there are two costs involved in every business, fixed and variable. And this is the first time in a year and a half, 2 years, that we've had discussions where a director has identified what are the minimal fixed costs. If you're a store owner, and I owned a business for 15 years, the day I opened that business, when I put the key in the door lock and turned it, I knew what my fixed costs were for that day, that week, and that year. HealthSource Rhode Island is the same. The director has given us a clear plan as to what the fixed costs are going to be. Now, the question is, the variable costs, people that we can enroll in that program, will it continue to rise to lessen that cost? That's the question. Our analysis is going to have to be, and the speaker has said, with the money we've put into this program, using an automotive analogy, it's like we're building a Maserati. And I said to him, I said, yeah, we're building a Maserati. What we really need is an F-10 pickup truck that can carry the load of a smaller population. Our analysis of this particular budget article is going to break down to, very simply, there's a cost to going back to the federal government. And a lot of people will say, you just give it back, there's no cost. The cost is very similar to the charges that our governor is going to initiate to maintain this program. Our analysis has to look at, will this program be self-sustainable under that model? And with that, we also believe that there's an opportunity to improve healthcare quality and also bring down costs through greater efficiencies. So that's going to be our initial analysis from a business perspective. And Gary was right, we can't rewrite history. I'm not big on Monday morning quarterbacks, but it would have been much easier if we had started this process with the hearings and the legislative process, where we could have folks like yourselves coming in, giving your opinion, you're paying the bills, you're running a business. And I would also ask at this time, we need business owners in the business community to come in when we have the budget hearings on this article to testify. Your opinions are important. So with that, thank you.
Don, how are we doing for time? Do we want to see if there are any questions on the floor? A few minutes? I have a lot more questions than I can ask, but I think part of the...
do one more and we'll get the microphone on.
Okay, great. So if I were to go back to Director Wallack and what you've heard today, any thoughts around the funding suggestion from either Professor Hackey or from Gary Sasse?
I think that the user fee is a very difficult model for all the reasons that have been articulated here. So I think that one would be tough in terms of direct straight appropriation. I think that's a possibility, but you know, given all else that the governor has going on in her budget and the kinds of savings she's already looking for, I think mirroring what we would be paying at the federal level, both in terms of the budget size and in terms of the revenue source, makes sense.
Director Wallack, one other question that I wanted to ask in terms of the membership, the enrollment, and the counts. When we look at some of the folks that have enrolled in HealthSource Rhode Island, not true just for Rhode Island, but all across the country, some of us worry that we've got some folks that are in there receiving subsidies that ultimately have the option for affordable health care where they work. And that there's going to be a process here over the course of the next year and a half, where they're going to discover or be caught, depending upon whether there was intent or not, and that is going to be a really unpleasant kind of thrashing out on the back end. Any thoughts along that?
Well, there will be a reconciliation through the IRS. So if somebody said, no, I don't have access to coverage through my employer, and then in the end they can't provide the attestation to that with their tax return, there will be a reconciliation. And like with all of the reconciliations in this process, there are some pain points around that. People who said my income is only going to be X and my income is actually 3 times X at the end of the year. That's going to be reconciled with the IRS too. So as we go through these initial years of those reconciliations, I'm sure there's going to be some surprises. But in general, I think people are aware of the requirements, and they will become more aware by year 2 or year 3.
We're seeing some things in other states. Connecticut, for example, has been sending out some of the notices, shared responsibility notices to employers, and kind of sort of test driving a process that really won't go live for another year. Any thoughts in terms of HSRI doing something similar, or starting to kind of try to get your arms around how many people are in the exchange with an issue?
I would love to see what they're doing in Connecticut. Actually, my new CFO and I met with Connecticut yesterday, and I think there are a lot of opportunities for us to learn from them and potentially find some scale by combining some of the services with them. So I'm not aware of what they're doing, but if it's good stuff, I'd like to learn about it.
Excellent. And one last question for Professor Hackey. You've done a lot of research. You've looked at a lot of states, and when Representative McNamara talks a little bit about the expense side and it's fixed and it's variable, well, the other piece of the equation is income, and we're looking really at sort of a funding model that doesn't necessarily take into account the possibility for an income stream, and I think that's been discussed at various levels. Do you see any opportunities for Director Wallack to sell her product elsewhere?
Well, it's hard to say because right now, if we look at around the country, some of the exchanges that are the best performing, if you will, in terms of signing folks up. I mean, Florida comes to mind. They signed up 1.6 million people using a federally facilitated model. They've accepted no federal monies to do that. They're using exclusively healthcare.gov. And so I think from where I sit, if our performance, particularly here in year 2, was substantially above the norm, I think we'd have a much stronger case that we built a better widget and you should buy our widget. I think we have a good widget. I'm not sure it's a widget that other states are going to line up in droves to buy at this juncture. We've had customer service issues. The software is still a work in progress. And I have to say, I give major props to Anya for owning this fiscal responsibility. I mean, you came into a tough spot. I mean, seriously. And it's refreshing. Honestly, I'm coming away from this event refreshed to hear the candor. There has been a lack of candor on this for several years. It's been a question of, well, we'll get there when we get there, and don't worry, be happy. Bobby McCurran's not singing the
I'm singing that in my head.
Yeah, exactly. And you need to, because you've got tough choices here. And I think the really refreshing thing is that we've got folks who are new on the job here, both the governor, the director, are seriously committed to making this thing work and work at a price we can afford. I mean, I think that has got to be the new model. But in terms of selling it to other states, I know that was discussed before. I don't know, I'm obviously not privy to whether we've tried to do that, but I'm not sure, looking at results that I've looked at, how many folks are going to say, Rhode Island's it, Rhode Island's the one.
Gary?
In terms of selling it to other states, and there's a section in the Affordable Care Act, I think it's 1233 or 1232, which talks about, listen, and it says, because what will be happening after the election, and then we talk about replacement, is there's provision in the Affordable Care Act for states to do innovation. And one of the issues that are talked about in that innovation are the kinds of things of scale and working together. So we're just at the really baby steps, right now. The kind of issues that you raised have been provided for in affordable care, that have been focused on. But as the act cemented as we go forward, I think there's an opportunity, and an opportunity with federal support to do that.
Okay, do we have a few minutes left? Great. Any questions from the audience this morning? We get a microphone?
Sorry, I could go.
Oh, I'm sorry. Elena,
Yeah, all right.
Thank you. Ellis Walden from Walco. I think many of us in the room may have experienced that, whether it's in government or outside of government, if the goal or mission isn't clear, then we see an escalated, adversely escalated budget and results. So my question would be, as you, Director, view our reduced costs in the future, what do you see as the role of our state exchange, and how does that role compare to the role of the federal government?
So obviously our central role is to sign people up for coverage and to the greatest extent possible connect them with the federal tax credits that make their coverage more affordable. I also think that we've carved out a great role for HealthSource RI in terms of serving Rhode Island's small business community, and that's something that we could really expand upon. And we, in particular, we have what we call the full choice model for employers, where small employers can come in, decide how much they want to pay towards their employees' coverage, and essentially get out of it. And we have a lot of tools for their employees to use to understand their choices of plans. They can make different choices across the group of employees. And our experience so far, while it's with a limited number of employers, is that that model really works for the small employers. And so I think there's a lot we can do there. And then I think getting to Senator Whitehouse's comments, I do think that we can play a part. We're not the be-all and end-all of cost containment and quality improvement, but I think that there's an important role we can play in concert with all the rest of the things that are going on in the state to address costs, to better engage consumers, and to improve the functioning of Rhode Island's healthcare system. I have one fan. But he's an important one.
an enormously important fan. I think some of us